Welcome back to the Wellness Decoded podcast. I'm Darlene, the nurse practitioner here. Today, we're going to talk about something that we talked about before, hair loss, but this time we're going to kind of combine it with something else. When you are on compounded semaglutide or Wegovy or Ozempic or Mounjaro, remember that you're rapidly losing weight. So sometimes you can have an issue. So we're going to talk about combining it with something called copper peptides. Copper peptides seem to be the healthiest and the most natural way to put your hair back in line with where you want to be. But in conjunction with the hair, it can also help with the skin. So we will talk about different methods of using the copper peptides as well. So why does hair loss happen with compounded semaglutide? Actually, one of the biggest reasons is because it's rapid weight loss. Rapid weight loss puts you in kind of a malnutrition state. It's deficiencies of protein and deficiencies of vitamins and minerals. So be careful. Don't lose weight so fast. To try to do it in a little bit more efficient mode. Nevertheless, when you lose your hair with compounded semaglutide, it's called a Telogen Effluvian. So the Telogen Effluvian is actually reversible. When you have other types of alopecia, it's not always, and this is beneficial. But in the process of losing our hair, sometimes it becomes thinner after you've lost the weight and the hair does come back. So a good way for us to bring back that hair and kind of cause the regeneration of that hair follicle is with something called a copper peptide. And those copper peptides are good for skin, hair, nails, all of that stuff. So there are a couple different ways that we can get this copper peptide in. It can be injectables and it can be oral, and it also can be topical. So when we actually decide what it is that's causing the biggest issue with you, that's what we'll prescribe based on that. Okay, so what are copper peptides? Well, today we're talking specifically about GHKCU. Okay, this is a popular copper peptide. It's the new craze out there that you see on the internet. The benefits of this is huge, but what it is short chains of amino acids that are bound to the copper ion. So this is specific to regeneration of skin cells, etc. So we're going to talk about a little bit about what it actually benefits. But in hair science, copper peptides help by remodeling tissues. So it increases the blood flow. It extends the anagen, which is the growth phase of the hair cycle. It also reduces inflammation around the hair follicles, which we talked about earlier. And then it stimulates the stem cells that are within the follicles to regenerate the new strands. Okay, a question I get a lot is, can you combine semaglutide with copper peptides or compounded semaglutide? Yes, of course you can. It is huge. We've seen great testimonies of patients that come in and say, I cannot believe that all my hair is like finally coming back in. So this is kind of newish to the compounded semaglutide world. But if you think about it, semaglutide, basically what it's doing is it's metabolizing your sugars. It helps with appetite and insulin. And then with a copper peptide, basically what you're doing is you're targeting local tissues. And so the health and regeneration of those local tissues is way different than the mechanism of action for the compounded semaglutide. So this means that they can work together simultaneously without any side effects or issues. Okay, so the best practices and what to avoid when you're on the copper peptide. If you're considering using both of them together, just make sure that you're using the copper peptide that is clinically backed formulas. Make sure you go through a provider, make sure you get a prescription. Combine these with supportive nutrients like protein, iron, biotin, zinc, and B. That's super important because, like I had said in my podcast previously, this can be related to malnutrition because you lose the weight so fast. Avoid overuse. Too much copper can be counterproductive, like too much of anything. It can oxidize and then it can cause a little bit of irritation to that scalp. Be patient. Hair cycles come in months, 3 months usually. So you might notice like improved shedding within 6 to 8 weeks, but regrowth is 3 to 6 months. So keep that in mind. Keep in mind that copper peptides are not a magic bullet. Just like compounded semaglutide is not a magic bullet. All of this is meant to be used in combination with good nutrition, exercise, diet, making sure you're getting everything that you need into your system. I'm Darlene Gonzalez. I am the nurse practitioner here. Consider subscribing, liking our channel, thumbs up, and please share, because the only way we can keep doing these videos is if you keep doing what you've been doing. We love you. Bye.